It's a very good, interesting point. I mean, I think the nature of the threat has changed in 5 years since we've been around rapidly. So it can be anything from the nature of the threat, from ones that go from these sort of very long and slow threats to what we saw in terms of the sort of WannaCry attacks on the NHS last year that were very fast. They happen at machine speed, often at speeds that a human being couldn't necessarily keep pace with.
So what does that mean in terms of your technology that you're helping embed? Because you work with the NHS and you were involved in the back of the WannaCry ransomware attack. So how does your technology stop against those rapid fire attacks?
The way our technology works is it's based on artificial intelligence, and so it's understanding the network that's specific to that given organisation. So, for example, even in the healthcare sector, no two healthcare providers or organisations are necessarily going to be the same. Their networks are going to be very different, they're going to behave very differently. And the nature of the threat within the healthcare sector is also quite an interesting one. If you think about the number of devices within healthcare, it could be, they're not necessarily the ones that we're used to that have screens or computers around us. They could be a CT scanner or a dialysis machine. Just because they don't have a monitor, it doesn't mean they don't necessarily have an IP address and have to connect to the network and therefore perhaps present a vulnerability. So it's about understanding that sort of normal environment for a given industry, of which healthcare is one. And only by using a sort of artificial intelligence can you understand that learning and continuously evolve as that business changes or that given network changes.
Poppy, Karen and I went to a dinner with a load of CFOs about a year or so ago now, and it was quite damning. They said, as good as our firewalls can be, as good as our security can be, it can be up to speed. It's only as good as our partners and our counterparties and the people we're communicating with as well. And if theirs isn't up to speed, then we can be infiltrated that way as well. When I go around various medical institutions, or the GP, or I was recently Hammersmith Hospital for visiting someone, there's an amazing array, as you say, of technology as well. And I can't believe that these amazing healthcare professionals who are spending so much time and so much money getting people well have got time or indeed the ability to keep their security up to speed as well. I see it, and I look at old Windows systems, and I just can't believe that we're not incredibly vulnerable despite what you're saying.
I agree. Technology is a massive, massive enabler within the healthcare sector. It's brought forward many, many advances. But as you say, with that increased adoption of technology, there is potentially increased risk. And businesses now are realising that perhaps at some point that breach is inevitable, and instead they need to focus their minds on how do they identify that breach when it occurs, and then being able to manage and contain it before that problem potentially becomes a crisis.
Well, I mean, what did we learn from WannaCry? You referred to that. That was April 2017 as well. What did we learn that, that can be avoided or easily avoided going forward? I
think one of those things that they've taught us is that these businesses should be doing something. Like, that's the first step. And first of all, that could be understanding the network, just getting visibility into the number of devices. Many of the healthcare people that we speak to, they could be saying there's many up to 25% of the devices they're connecting to their network, they just have no visibility over. So how can they monitor those and make sure that they're behaving in that normal way, in that behavior that they would be expecting? And then it's all the best practices about keeping those systems and patches up to date and making sure that they're following that sort of basic cyber hygiene. I think if they get those basics right, then you are far more likely to be able to avoid a breach.
You service a number of different networks, 7,000 networks, but also you have deployments in financial services, government and defence. Does a company or organisation need to think clearly about what they're protecting, what they're defending, or is it all important because there are so many entry points?
I think that the days where cyber threat was simply about going into a network to steal sort of credit card information or something that was potentially financially valuable are gone. These days, any data that resides within a network could be potentially valuable to an attacker that's perhaps trying to undermine the trust in a given organisation. The healthcare sector obviously contains incredibly valuable data that's personal to the patients. But also the ongoing running of those systems it could potentially save a life. So it's more important than potentially other sectors to make sure that they
40 years ago,
operate.
I'm picking a random date, there were probably very few, if not no, computers in hospitals and GP surgeries and what have you as well. Does the healthcare industry, it's almost sacrilegious to say, have the ability to actually go back to basics if everything goes down? I mean, have we just come so far technologically that we're in so much trouble if the technology goes down? I kind of like the backup.
I mean, I think what we saw in WannaCry is that was a very pernicious attack, and it was one that was very widespread, but it was able to be handled, it was able to contain. However, what we did see then subsequently was the NotPetya attack. So what that taught us that whilst we can perhaps get on a front foot to protect ourselves from a potential attack, that attack will always change. There will always be an attack.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.